So this is Rebecca Stetzer. Rebecca is a member of my team, and she is a dietitian extraordinaire. She's worked in many different areas, but primarily working with eating disorders, disordered eating, working with families in terms of family nutrition, and really helping both prevent and treat eating disorders in adolescents as well as adults. So maybe Rebecca, can you just share a little bit more? Because I know you've had some very specialized training, which I'd actually rather you talked about. Yeah.
Okay, sure. So specialized training, I've went through a 2-day intensive training on family-based therapy or family-based treatment, which is essentially empowering the parent and caregiver to help their child, adolescent, teenager who is struggling with eating, struggling with eating disorder behaviors, to help them learn how to refeed themselves, get their bodies back to a healthy place, and then slowly transition that responsibility back over to the child towards the end of treatment. So that was a really interesting and helpful workshop to go through, and it really helped me inform my practice and help adolescents and teenagers.
That's wonderful. We've just seen so many since the start of the pandemic. Yeah, more than ever. You also have some body image training I was reading about. Can you just speak to that for a moment?
I did an online training for it's called the Be Body Positive. And it's a program that was put together by several therapists. One is a licensed clinical social worker. The other is a therapist, and it's a model that encompasses health at every size. It encompasses intuitive eating. It really helps people reject diet culture, reject the ideals that our culture has around thinness and beauty standards and things like that, and really getting back to declaring what their own beauty is. And I find it to be such a empowering model. And it's something that can be used in a group setting. It's something that I bring into my individual work with people, and it's just really powerful.
I agree. I'm also certified in I'm a Be Body Positive facilitator, and I use it in all of my sessions. And body image work, it's really so important and critical to helping people heal their relationship with food. And certainly as dietitians, there are many things we can do within our capacity. But I do want to say that you've had quite a bit of training in not just nutrition, but in applying psychology. I know that you're working on your master's degree. Is that correct?
Yes, yep. I'm working on my master's degree for mental health counseling. And I will say that just that education so far has been amazing in helping me broaden my skills and my knowledge, and finding new ways to help people in changing their relationship with food and their bodies. It's been really, really helpful.
No, I agree. I mean, I see how you are with your clients, and I think you have a level of depth and understanding that honestly surpasses a little bit of what not surpasses what most dietitians how they communicate with their clients and families. So I so appreciate that. Thank you so much for sharing about how you do use some psychological techniques in dealing with your clients. Do you have any particular specialty or anything that you would say you really are your quote unquote ideal clients?
That is a great question. I struggle answering that question, actually, because I like working with such a variety of clients. I would say that I do well working with families, parents, adolescents, teenagers, helping with any kind of, just eating disorders, disordered eating, picky eating, different struggles that parents might have with their kids. I really enjoy working with that population. I like working with college students too. I really enjoy that. And I like working with older women as well, 50s, 60s, and beyond. I like all of those, just a variety of clients.
No, thank you so much for sharing that. Thank you. You've actually seen quite a few clients with both eating disorders as well as gastrointestinal issues, GI. Could you comment a little
Oh,
bit because you really have helped them. So yeah, maybe you can comment a little bit about that, your work with GI.
thank you for bringing that up because I was also going to bring that up. I have a particular interest that's growing in folks who struggle with disordered eating and gastrointestinal issues. So whether it be IBS or constipation, bloating, um, those types of things are so connected. They oftentimes hand in hand. Yeah, and so I do really enjoy working with people who struggle with that.
You know what? It is so prevalent, and people often, it may even start out with GI issues, may have irritable bowel syndrome, may be really struggling with their, you know, bloating or whatever the symptoms are, and then they, without even realizing it, they start to restrict their food, take in less and less, and it's almost like, what's the right word? Almost like a self-fulfilling prophecy because the less you eat, the more the symptoms increase because your gastrointestinal tract really needs to be used regularly. So,
Exactly.
yeah,
Yeah,
no, that's a
like
really good point.
it might back themselves into a corner where things get worse. So yeah, I
Yep.
really like when people see that that is what is happening and understand why that happens.
No,
Okay.
so Rebecca, you have a lot of really varied experiences, and you work with a wide variety of clients. Um, but I would say that from what I'm observing, I mean, you are wonderful with all populations, but I think you have a special, I notice a special proclivity towards family work and adolescents with eating disorders, um, and all that entails.
Thank you.
Having your own family, I know being a mom, I think that our personal experiences really do inform the work that we do. I
Oh
think I
yeah.
say this, that I learned from all my mistakes and all my wins.
Absolutely. I think it helps just, to be able to relate too, you know.
Absolutely. Well, thank you so much for chatting with me, Rebecca, and I'm so thrilled to have you on board. I really am.
Yeah, thank you. I'm so happy to be a part of the team. It's been
Yeah.
wonderful.
All right. I'll speak to you later. Thank you so much. Have a great day. All
You
right.
too.
Bye.
Bye.